If you've been watching men's health videos lately, you've probably seen some alarming headlines. Baking soda boosts circulation instantly. Doctors don't want older men to know this trick. Just one spoon fixes blood flow problems. For many men over 50, these claims create confusion and sometimes false hope. You may wonder if something so simple could really help, or whether it could quietly cause harm. I'm Dr. Morgan, a licensed urologist and men's health specialist. Every week I speak with men who try home remedies without understanding what's happening inside their bodies. In this video, I'm going to explain what men should stop doing with baking soda, why using it alone can backfire, and how combining it responsibly with the right type of support may help circulation, especially as we age. One of the points I'll share surprises many men, because it has nothing to do with blood vessels directly, yet it affects them deeply. Make sure you stay until the end, because understanding how blood flow works after 50 is far more important than chasing shortcuts. Let's begin. 1. Stop using baking soda. Without understanding acid-base balance, baking soda, or sodium bicarbonate, affects the body's acid-base balance. Your blood operates within a very narrow pH range. When that balance shifts too far in either direction, circulation can suffer. Some men take baking soda hoping to thin the blood or open vessels. But when used alone and repeatedly, it may disrupt stomach acid needed for mineral absorption, increase sodium load, alter electrolyte balance. In men over 50, especially those with high blood pressure or kidney concerns, this can actually impair circulation rather than improve it. Key takeaway: blood flow is not about alkalinity alone. It's about balance. Why minerals matter more than alkalinity. Blood vessels rely on minerals to relax and contract properly. Magnesium, potassium, and calcium regulate the smooth muscle lining of arteries. Without them, vessels remain stiff even if blood chemistry looks alkaline. Baking soda alone provides sodium without the counterbalancing minerals needed for vascular relaxation. Over time, this imbalance may increase vascular tension, raise blood pressure, reduce nitric oxide signaling. This is especially relevant for men with diabetes, obesity, or metabolic syndrome. Circulation is like a symphony. One instrument playing louder does not improve the music. There is the role of nitric oxide and why baking soda isn't enough. Nitric oxide is the molecule that signals blood vessels to widen. As men age, nitric oxide production declines due to endothelial aging, insulin resistance, inflammation, smoking history. Baking soda does not directly increase nitric oxide production. Without supporting nitric oxide pathways, improved blood flow is unlikely. This is where many men misunderstand the mechanism. Blood flow is not about forcing vessels, but it's about restoring communication between nerves, muscles, and vessel walls. Why pairing with amino support makes more sense. Nitric oxide is produced from specific amino acids in the body. When men lack these building blocks, blood vessels struggle to respond regardless of alkalinity. Responsible dietary support may include amino-rich foods or protein sources that help the body generate nitric oxide naturally. This is especially important for men who eat low-protein diets, have muscle loss with aging, experience fatigue or slow recovery. Think of nitric oxide like a message. Without paper and ink, the message can't be delivered. Blood sugar control has a bigger impact than any powder. One of the most overlooked factors in circulation is blood sugar. High glucose damages the inner lining of blood vessels, reducing their ability to respond to nitric oxide. Men with prediabetes or diabetes may notice circulation issues even if they try supplements or remedies. Baking soda does nothing to address blood sugar spikes. Without stabilizing glucose levels, nerve signaling weakens, vessel elasticity declines, blood flow becomes inconsistent. Good circulation depends on metabolic stability, not shortcuts. The most important rule: never replace medical care with home experiments. This final point is critical. Baking soda is not a treatment for circulation disorders, vascular disease, or erectile dysfunction. Men over 50 often have underlying conditions such as atherosclerosis, hypertension, hormonal decline, nerve sensitivity loss, Experimenting without guidance may delay proper diagnosis and care. The most effective improvements in blood flow come from lifestyle adjustments, medical evaluation, nutrition balance, consistent physical activity. Your body deserves informed decisions, not internet guesses. Closing. Let's summarize. Blood flow after 50 is influenced by mineral balance, nitric oxide signaling, blood sugar control, vascular flexibility, overall metabolic health. Baking soda alone does not address these factors, and in some cases, may make things worse if used carelessly. If you care about your circulation, energy, and long-term vitality, focus on understanding how your body works, not chasing quick fixes. Men's health should never be a silent struggle. Talk about it, learn about it, take it seriously. Your health is worth that effort. Thanks for watching.